A hammer toe is essentially a deformity to the toe where it kind of bends up like that, right at the knuckle of the toe. It's most often involving probably the second or third toe, but certainly all of them can be involved. It is an issue that happens as a result of basically an imbalance between the muscles and some of the pull on that toe throughout the foot, which causes that deformity. Certainly some different shoe wear options and things like that can maybe play into that, but it is a deformity to the toe. Sometimes it's flexible, sometimes it becomes rigid if it's more arthritic, but more or less a curling of the toe in the simplest way to explain it. There are conservative options for hammer toes. It really depends on whether they're rigid or flexible. There's different little toe straps and sleeves that may be more to accommodate the deformity. When it gets to the point where shoe wear changes with a taller toe box to give your toe some room, or toe sleeves or straps are not helping, I think it's time to probably go see an orthopedic foot and ankle specialist, and then they can talk to you about different options. Oftentimes it can be a combination of soft tissue releases around the toe to actually taking out that knuckle to make the toe straight. What I'll tell people is if bone procedures or even if it's soft tissue procedures are necessary to straighten the toe, you may not necessarily get any of that motion back. So the trade-off is that you're alleviating pain and correcting the deformity for a stiff straight toe oftentimes. I think that's going to be kind of the big thing that people should be aware of if they're having hammer toe surgery, is that toe might be stiff. It's not going to be able to pick up marbles or do anything normal like maybe it used to be, but that's the trade-off. I think toe spacers are great to alleviate toes from rubbing on one another or if there's a painful callus, but toe spacers are not going to correct a toe deformity or a crossover toe or overlapping toes or anything like that, but they'll create room. That toe is going to go right back to where it was when that spacer comes out, most likely. So that's probably very subjective. I think the thing to recognize is that some people have very narrow feet. Some people have very wide feet, and that may be for different reasons, but you essentially just don't want the shoe to be causing excessive pressure on the inside or the outside part of your forefoot. The challenge with that is if you get a wide enough shoe in the toe box, that might cause a very wide heel. And then your foot's just kind of flopping in and out of your shoe. So trying to find the right shoe option that has a toe box that's going to accommodate a wide or a narrow foot, but also not compromising the width of the heel. I think that's going to be very important for people who have issues with, appropriate fit of shoes. But you basically just don't want excessive pressure on the prominences around the foot that can cause a callus or a painful sore. So the time to see somebody about hammer toes is basically when they start to cause you significant pain despite over-the-counter toe straps or spacers or appropriate shoe wear changes. I'll urge people to maybe see somebody a little bit more urgently. If you have recurrent wounds on the top of that toe where it's rubbing on shoes, or even if you've had little infections in that area, last thing you want to do is get a recurrent wound or a long-standing wound on the top of that foot that gets infected, because if you get a deep infection as a result of that, particularly if you're diabetic or have neuropathy in the foot, then your options as far as salvaging that toe are probably limited in that situation. So pay attention to your foot in that situation, but otherwise for people who have normal feeling in their feet and aren't developing wounds, it's just when the toe bothers them enough.